who have joined us today. My name is Ishmeet, and I welcome you all to the Eye Sampark webinar CME initiative of Bhargav Phytolab, sponsored by Spontan Drops. So today's webinar is again the continuation of what we had yesterday with Dr. Krutik Shah. Dr. Krutik Shah is from Gujarat, and he is going to take the webinar Dr. Henneman's perspective for homeopathic management of epidemic diseases. The conclusion of this, I've got from you. I would like to wish happy Dhanteras to all the doctors. Dr. Krutik, can you hear me? Are you there?
Yes, I can very well hear you. But your voice was coming in
Right.
breaks.
So
I
I
was
think there
not
is some
able to.
technical glitch.
Yeah, from your end, I think I was not able to hear
Yes.
you. I was not able to even able to see you clearly as well.
All right. I'm sure, sir, there is some technical glitch at our side. I would request you to please take this webinar ahead.
You mean I should start?
Yeah, doctor.
Okay. Okay. So today we are going to take up something which is what you call okay. So from yesterday we are going to take up the aphorisms about management of COVID, about management of epidemic diseases with homeopathy, right? Good afternoon, everyone. Am I audible to you? Can I have your feedback? Is the internet is okay? Is the video is okay? Are you able to see the screen as well as properly or what? Yes, please. Can I have your feedback? Quick, so that I can understand in a better way. Yeah, very nice, very nice, very nice, very nice. Thank you, Dr. Hitarth Mehta. Thank you, Dr. Vijay Lakshmi. Thank you, Dr. VK Singh. Thank you, Dr. Dorothy. Fantastic. Okay, let us start. Okay. So now I want to take you about the management side of the acute, management side of the epidemic. Okay. So from here, the shift of aphorism is changing. Now, we have really questions why people have relapse. We have treated with COVID. I have seen a case from Surat who had a relapse of COVID 4 times. Right? Why people have relapse? This is quite surprising. Just a second. I think I need to fit my screen. Yeah. Okay. So why people have relapse? Why? Because there are many reasons. And up to that, we are going to take it up here. Now, as I said, this the aphorism 103 is about case taking of epidemic. Then we go to the management side. Okay, so here what Hahnemann tells is something very beautiful. The way you are able to trying to find genus epidemicus, or the way you are trying to find out the common remedies fitting to most of the people. Similarly, you have to try and find out miasmatic chronic maladies. This forget about this aphorism. We have an experience that the patient of COVID become more serious if he has cancer in the past, or bypass surgery, or full blown diabetes, or of an age. Why? Because of this aphorism is working. In the same manner, has here been taught relative to epidemic disease, which are generally of an acute character. But as I said, if you have, अगर आप में चोरी करने की दानत है तो ही आप चोर बनेंगे. अगर आप में सेवा भाव है तो ही आप संत बनेंगे. अगर आप में वो एक्यूट डेवलप होने की टेंडेंसी है तो ही आप एक्यूट डेवलप कर पाएंगे. So the point here is why the people have acute. So here, this is the acute character. I already said yesterday. We have epidemics are always acute. Epidemics of cholera, epidemics of measles, epidemics of smallpox, epidemics of corona. There is no epidemic of constipation. There is no epidemic of migraine. There is no epidemic of depression. So here it goes without saying, consider to the lecture taken previously, that epidemics are acute. But the chronic miasmatic maladies, which I have shown, always remain same in their essential nature, especially to SORA, must be investigated to the whole sphere of their symptom in a much more minute manner that has ever been done before. So why the patient is acute? Why patient goes in ICU? Why patient dies? The reason behind is the chronic miasmatic maladies, which are 82nd aphorism. Every disease is chronic, soric by nature. Every remedy is soric primarily. So here what Hahnemann tells, the chronic miasmatic maladies which are there in COVID is cancer, diabetes, kidney failure, or age. These are the issue. Bypass surgery, heart issues. They are the miasmatic chronic maladies which are there working a vicious way, ending the life with acute what you call COVID. And that is what Hahnemann says must be investigated. You need to investigate the chronic state as well. And what is that ultimately is reflection of SORA. So now this is about management of what you call beyond the COVID, to prevent relapse. What we should do to make the patient better, what you call in a convalescent period, what we should do. This is that aphorism. And in that, Hahnemann tells even more beautifully. For in them, one patient exhibit one set of symptom, second patient exhibit second set of symptom, third patient exhibit third set of symptom. So people died because of bypass surgery, may not have cancer. People died because of diabetes, may not have cancer. People have died because of cancer, with the cancer in the past, may not have diabetes. Patient dying because of kidney failure, never had cancer in life. So what Hahnemann tells here is the way genus epidemicus 82 102 aphorism. Oh, the total picture of COVID, as I said yesterday, we have 85 set of symptoms in total, which we have seen treating hundreds of COVID patients in practice. Similarly, not all the symptoms are coming into realization from one patient. Similarly, the chronic miasmatic state also will never be learned from one patient. So one patient will exhibit one set of symptoms. Second patient will exhibit second set of symptoms. Third patient will exhibit third set of symptoms. Fourth patient will exhibit fourth set of symptoms. So what will happen? That is this portion of totality of symptom which constitute entire extent of this malady. Similarly, as I said yesterday, one corona patient may not have throat pain. He has coryza, then COVID pneumonia, no throat pain. Other patient, COVID started with throat pain. One patient, no loss of smell of or taste. One patient has a loss of smell and taste. One patient has, as I said yesterday, saliva salt, saliva taste bloody. One of my patients said, I have, as if something it died and putrefied, I'm getting that smell in my nose. So what is this totality of symptom? Is in portion coming to you. When you take acute, also comes in portion. And when you try to find chronic miasmatic maladies, which are soric of an origin, this word, chronic miasmatic maladies, soric of an origin, also will come to you in parts. So what you are supposed to do is that you have to take constitutional symptoms, you have to find chronic symptoms, and that you can only be able to find is very many single patient, very many individual patients. So very many single or very many specific patients, 147 aphorism. So in this way, what Hahnemann tells is, if you are trying to find chronic miasmatic state, not one patient will give you everything. You can ask yourself, the homeopaths attending this webinar can ask yourself, how the people died because of COVID may have diabetes. They were not having cancer, but they died. People died because of COVID, had cancer in the past, but they were not having diabetes. Patient died because of bypass surgery and age, neither had cancer in life, but all conclude to one story. What you call these are the symptoms. These are the what you call chronic miasmatic states, which are reflections of Sora coming to trouble the life, and which eventually ending the life through acute character. This you have to take care of it. That's why senior citizens die, because they most have incurable cases, chronic manageable cases. You know, kidney failure, arteriosclerosis, a bypass surgery done, cancer, kidney failure, and what not, hypertension. What these issues plays a major role. So what is there? What Hahnemann tells is, अगर आप में चोरी करने की दानत है तो ही आप चोर बनेंगे. अगर आप में सेवा करने का स्वभाव है तो ही संत बनेंगे. अगर आप में कोरोना से डेथ होने की टेंडेंसी है तो ही आपकी डेथ होगी. अरे अगर कोरोना होने की टेंडेंसी है तो ही कोरोना होगा. So Hahnemann is so specific, absolutely specific, that if you have a tendency, you will have disease. So otherwise, exciting cause will never damage, will never trouble, right? So it's like that. Just a second, I'm getting an important call and I need to pick it up. Just a second. This way, this aphorism is related to this. What is needed? What is needed is without a complete survey, collective picture of these symptoms, medicines capable of curing the whole malady homeopathically to with antisorics. You will what will happen? Relapse. You treat COVID, a relapse. You treat another COVID, same patient, second relapse, recovery, third relapse, recovery, fourth relapse, recovery, fifth relapse, recovery, sixth relapse, recovery, because you are not able to touch the constitutional side of the patient, which is responsible for the development of acutes. And that is what Hahnemann tells. Without a complete survey and collective or picture of these symptoms, medicines capable of curing the whole malady homeopathically cannot be discovered. And again, a beautiful, these medicines are at the same time true remedies for of the several patients suffering from chronic affections as well. So what you did, say for example, you had a COVID, you treated for acute, then you have to take a case of that patient for constitutional homeopathic care. Otherwise, he will end up into COVID again. Otherwise, there is a risk of relapse again. So it's nothing like take a patient, then let it go once you treat them with COVID. What Hahnemann says, you sit with them and try to find antisoric remedies, what you call the deeper most remedies, where constitutional you are able to treat them. If you read Theory of Chronic Disease, Hahnemann has given a list of 50 remedies which are primarily antisoric. very efficient antisodic remedies, right? So in this way, you know, we have treated acute, but we have to treat the chronic. Otherwise, relapse. Say for example, in Corona, let me tell you, we don't know how many COVID patients are roaming around us. Are we staying with a COVID positive patient? We don't know. I mean, you are meeting strangers. What was his life of past 15 days? How many times he got exposed to COVID? You don't know. Say for example, you are traveling on a road which is a very very busy road. Coronavirus is there in the environment for 8 hours. Coronavirus remains in the air for 8 hours. A person has exhaled COVID virus, it's floating in the air. You are traveling, you take it in your nose, you may develop a problem. So in this situation, just a second. I think I'm getting another call. Okay, so in this way, we have a tendency, then only we produce disease. Otherwise, it's not possible to produce disease. And this is what management of COVID or management of any damn epidemic you take on the planet. And in this, to this, let before going to the management side, to this is very needed that every COVID you take acutely has to be treated constitutionally afterwards. Otherwise, we know now the world is coming into reality that COVID is producing permanent lung fibrosis if they have COVID pneumonia. COVID is producing kidney failure. COVID is producing diabetes. Kidneys are badly damaged because of COVID. Who knows what is there in the future? So if you want to prevent these type of complications, chronic complications of COVID, treat them constitutionally. So it is like, one shot, three benefits. Once say for example, there is a patient of COVID. I treated him constitutionally with arsenicum album. Better. You have to take the case again to just inquire which is the constitutional defecting chronic antisodic remedy that will prevent relapse, that will boost up the immunity, and that will prevent the complications. After proper chronic homeopathic care, you can forget that the patient can go to best of life, no problem. This is 103. Why COVID are having relapse? In allopathy, there is, people, I have seen patient in Anand where I live, a patient developed relapse third time and he died. Third time and he died. Why? The answer is 236 aphorism. I will tell you once we finish this. So this is about 103 investigation of SORA and antisodic remedies. So what is, this is complete about case taking. Case taking now, this is beyond acute, you have to see constitutional. In many cases, I tell you, the acute remedy work constitutionally as well. No question. But many times it does not as well. So you need to be ready. Right? Friends, are you able to receive me properly? Should I proceed ahead? Can I have your chat? I think this Zoom doesn't like me. I am not able. Yeah. Thank you, Dr. Soni. Thank you, Dr. Sunita. Very nice. Thank you, Dr. Ufris. Thank you, Dr. Anuradha. Thank you, Dr. Vijay Lakshmi. Thank you, Dr. Surya Kanta, ma'am. Thank you very much. Thank you, everyone. Okay. Continue. Now, 235. This is something which is what you call acute, which is of, why Donald Trump threatened India that you please give me chloroquine. Otherwise, you have a problem. This aphorism is telling that it's a foolishness to give chloroquine. Donald Trump should have read Organon, I would say. Donald Trump should have read the history of epidemics in the past centuries, before threatening India for chloroquine tablets. Right? So what Haniman tells here, that is fun apart. Okay, I cannot advise Donald Trump to read. It's like Organon. Now Biden is the next president of US. So with these 235, What Haniman tells, whatever COVID you take, whatever COVID you take, every COVID will be completely different to some extent, at least definitely, than the whatever COVID you have seen or whatever COVID you are going to see. With regard to intermittent fevers that prevail sporadically or epidemically, we often find paroxysm. Cold, many patients are coming and telling you, doctor, I had chill first, then I had heat. Many patients will come and tell you, I had heat first and then I had chill. Many have heat, cold, and sweat. Typical what you call paroxysm. Right? Here, what Hahnemann has used the word, see, beautiful. Hahnemann has used the word beautifully. Pathology is a stage of irrational infancy. Pathology अभी बच्चा है. Pathology is just a child. It's an immature child. It's an immature infant which consider everything in wonder. One name, egg. Intermittent fever in a town, egg. Malaria fever or shivering, whatever. And no other varieties of the appearance other than quotidian, tertiary, and quartan. What allopathy says? There are tertian, quotidian, and quartan. That's all. This type of wound is only the possibility of malaria. These can be the way how malaria is defined or egg is defined. What Hahnemann tells is completely advanced, completely scientific, and completely true. Is this? How many times you have seen a COVID where patient is feel hot inside, externally you touch, patient is normal. How many times you have seen a COVID, you touch outside, they are hot, internally they feel coldness. One COVID has excessive perspiration. One COVID has no perspiration. One COVID head hot, body cold. One COVID tummy, upper part of the body hot, lower part of the body cold. One COVID has warm heat in local parts. This is complete varieties, which allopathy doctor don't want to believe. Hahnemann says. That's why it says irrational infancy. Pathology bhi bachcha hai. So what Hahnemann tells, one fever consists of heat, another fever consists of cold with or without perspiration. One fever has internal coldness, one fever has internal heat, one fever has no stage of perspiration, one stage has profuse perspiration. Everything is individual. How can you say that fever is only quotidian, tertian, and quartan? No, it's completely individual. As I said yesterday, one of the COVID I saw, COVID point were 12. No, pneumonia points were 12. He had no fever. I was amazed why this person has no fever. Right? Calciracab was the remedy. He cleared everything completely. Right? One of the patient, as I said, only 5 points, mild pneumonia, 5 points, had 104.1 degree temperature. This is complete individuality. That's what Hahnemann says here. You cannot match people under a format. You cannot match the people with a protocol. That's why in homeopathy, there should not be a format of case taking, because you cannot put all the vital force under one format. Every case is individual. So where homeopathy is getting, homeopath is failed, not homeopathy. And it's unfortunate that the blame of homeopathy comes, it is unfortunate that the mistake of homeopathy comes as a blame to homeopathy. In other way, I tell you an example. Only a week ago, a patient of COVID, he had three blankets on his body because of severe chills. His father, his father also had COVID. He had no rigor at all. No rigor at all. Why? This is individualization. So what Hahnemann tells, different intermittent fevers are there. They are not just three. And believe me, they are actually not three. If you take the case in detail, you will find lot of variations. Lot of variations. Into that, again a beauty. What Hahnemann says, you check the accessory symptom of the patient. It will be completely different. I tell you headache. One of my COVID patient has headache only on the right forehead. That's all, here only. Doctor, I have severe pain here only. One patient says, I have headache with my eyes are paining in COVID. As I said, one of the patients said, my saliva tastes like blood. You know, nausea. One of the case I saw about arsenic. Sight and smell of food produces nausea tremendously. Right? One of the case treated with camphor, severe vomiting. It has no, some patients have diarrhea. Some patients, typical thirst of arsenic, small quantity frequently. Pulsatilla thirstless, AP is thirsty during chill, thirstless during heat. All these are parameters so individual, which defines the remedy. Diarrhea from want of excessive thirst, peculiar pains in the body. As I said, one of the patient was telling me that, sir, my legs are breaking. I have tremendous pain in my legs. And the other patient says, sir, I have severe lumbago. I cannot bear it. The third person will say, sir, my whole body is completely bruised. I feel I've been hit by 100 sticks by 10 people. This is something individual. Disturbed sleep. One of the COVID patients used to sleep continuously. It was antimptat. He had COVID pneumonia. Sleeping. Antimptat. So this is something which is absolutely individual. One of the case I treated was a very bad case of COVID. I first gave bryonia to that patient. Bryonia acted only 50%, and then the temperature was 104.6 degree. I was really worried. Should I advise him to go to the allopathic hospital, COVID hospital, get admitted? Then I said, no. Let me read organon. Let me see what I'm missing here. And in that way, 167 aphorism came and helped me to how to change the prescription in acute. And I gave belladonna. Within 2 days, patient was absolutely normal, as if nothing has happened with him. So these are accessory symptoms, are pure individual category. Forget about accessory symptoms. Before, during, and after cold stage, before, during, and after heat stage, before, during, and after sweat stage are completely different. Completely different. All these are manifestly intermittent fevers of very different kind, as might naturally, we suppose, requires a special homeopathic treatment. Special has a special meaning in homeopathy. 147 aphorism. Specific homeopathic remedy. Special homeopathic remedy. Every single patient. So in this way, you need a constitutional treatment, or what you call acute proper homeopathic treatment, guided by the symptoms of the individual, guided by the individual symptoms of the patient. So in this way, about differentiation, how to treat, how to treat. There are two possibilities. Either you have what you call how to manage an acute is a lecture of 2 hours, which I have just I guess I gave last time in Radar Opus webinar. If it is available on YouTube, you are requested to see that. Maybe you get a better idea about it. That will help you as well. So acute management. Here, because epidemics are acute disease, it will give you only two possibilities. Either you treat acutely or you treat constitutionally in terms of chronic constitutional picture if you have limited acute symptoms. So here, what we are trying to match the chill stage exactly, match the fever stage exactly, match the perspiratory stage exactly, match the generals exactly, match the particulars exactly, match the mentals exactly, and then you give a remedy. Or the opposite. I had a case of COVID where there was no symptom at all. Patient has, I have little obstruction in the nose, that's all. And my COVID test is positive. I have little body ache, little. No specific. What you will do? Constitutional chronic symptomatology will help you. Remedy was lycopodium. Patient is really enjoying his good life. So in this way, be the either surest likewise to produce 2 or 3 similar alternate states. Proper acute totality, proper, or correspond by similar symptom in the most homeopathic manner possible to be the strongest base mark and most peculiar alternating state. Right? So either you treat constitutionally, or there is what you call sectorial totality. You take the totality of heat stage, you take the total chill stage, you take the totality of perspiration stage. That is also likely a possibility. But what is needed is ultimately totality of the whole. Totality of symptom. So in this way, either to cold stage, either to hot stage, either to sweat stage with accessory symptom or alternating state, whatever is coming to you, you have to match and match on the symptom which you are sure of. That's what Hahnemann says in 92 aphorism. There is nothing like clear picture in acute. You should prescribe on reliable symptom. You should prescribe on sure symptom. You should prescribe on confirmed symptoms. Otherwise, oh, this patient cannot be pulsatilla because he is not mild. Oh, this patient cannot be arsenic because he is not greedy. Oh, this patient cannot be sulfur because he is not egoistic. No. So either or, right? Here, the most important, I would say, and the real scenario, what is need of the present situation, but the symptom on the patient's health during the interval when he is free from fever must be the chief guide to the most appropriate homeopathic remedy. I received a call from a wonderful doctor from Bangalore, if I'm correct. She asked me a very legitimate question. She asked me very right question that my patient are having relapse, and I have requested her to ask in public so that let other people get the benefit. This is the answer of that question. If patient has relapse, what you should do? Patient held during interval when is free from fever must be chief guide to the most appropriate homeopathic remedy. Constitutional state, constant individual state, constitutional, constant individual. And here, Donald Trump, the way threatened India for chloroquine, what Hahnemann tells 250 years ago is not advisable. Criticism to the use of chloroquine for suppressing various individual and epidemic intermittent fevers. What Hahnemann says, it not only suppresses its periodical reoccurrence by its large and repeated dose, but never restore to health. What is the scenario of USA? Equal deaths, no change at all with COVID, with Syncona bark or with China, what you call chloroquine administration. But what happened? The opposite. They now remain ill in another manner. Why COVID affects lungs, pulmonary lung fibrosis? Why COVID affect pancreas, diabetes? Why COVID affect nephrotic, disturb what you call destruction, what you call typical beginning of CRF, right? Why? Is because these they now remain ill in another manner. So COVID has gone, but the after effect remains, and worse, often much more than before. Is now affected by Cinchonabark dyscrasia, chronic Cinchonabark dyscrasia. So what has happened with Donald Trump? He gave chloroquine blindly to everybody, to the citizens of the country. No, no major change happened, and as a result, the corona became worse in US. The people, the death ratio, the troubles are equally the same. And it is as if Cinchonabark has produced no improvement at all. This is the aphorism. And what Hahnemann tells here, that if you want to take acute properly, use Bonnie-Gusen's repertory. There are only two homeopaths Dr. Hahnemann appreciated is Dr. Jar and Dr. Bonnie-Gusen. Bonnie-Gusen has made a great contribution in homeopathy with his repertory. Now, this is what you should read. This is what you should follow. That will help you to make a better homeopathic prescription. So what Hahnemann tells here is something absolutely specific. It's a big aphorism, 235. But let me take you in a very nutshell. Every case is not the quotidian, tertiary, or quaternary. Every case does not have chill, heat, and stowage. It is stages. It's completely individual. It can be like internal coldness, external hot, external coldness, internal heat, with perspiration, without perspiration, with body ache, without body ache, with vomiting, without vomiting, with nausea, without nausea, whatever. Accessory symptoms can be completely individual. Diarrhea can be different kind, headache be different kind, nausea different kind, want of thirst different kind, pain in the body different kind, sleep pattern different kind. And it's all about energy. Disease blocks the energy, remedy frees the energy. So after the remedy, patient becomes more energetic. right after simillimum, right? So this is how the expression of the energy disturbance is completely individual in every case. So in this way is this. Next, how to treat? Either or, either or, but at the end is antisoric. That is coming to next aphorism. And the last is, don't give chloroquine blindly. Don't prescribe quinine sulfate for suppressing fever. What will happen is they'll end up into situation. Now in allopathic hospitals, what is the scenario? People are going with acute, but after some time they'll end up into some major chronic issues. Especially if you see in Bombay, if you see in Bombay, people are suffering from lung fibrosis. One of the wonderful homeopath and to whom I really admire, Dr. Kavita Chandiramani is already attending this webinar, and we have discussed about it very frequently, because allopathic treatment is really suffering, making the patient to suffer chronically rather than to take them out of it permanently. This is really an unfortunate event, right? 236. Friends, can I have your feedback? Quick, 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 quick. Am I going okay? Are you able to understand? Hope I'm not producing a belladonna proving on you, huh? Throbbing headache with photophobia and all. I can't see your comments. Yeah, thank you very much. Thank you. Yeah, thank you very much. Okay, fantastic. Okay. Now is all about what you call 236 do's and don'ts of intermittent fever. In which cases of COVID you should enter, which cases you should wait, what you should do. But in COVID, in epidemic, what it was managed 250 years ago, very different the story than what is today. Today, before patient come to you homeopathically, they go to allopath, they take allopathic medicines, and they are, you know, what you call already under suppressed effect. So constitutive symptom will be masked. 236 says very clearly that the administration, application of homeopathic medicine is at the end of the paroxysm. That is where vital force is getting into a peace after the suffering, after cyclone, after a tornado, and there vital force will be you will be able to balance. It's like a wave. Say for example, a wave of sea. You go in a sea, a wave is coming, you can't go to that wave, otherwise you'll be thrown by the wave. You see the sea sailors, they usually go with the wave, and as soon as the wave falls they come down and they enjoy the sailing. Similar is the situation. The paroxysm enters, it is the right time for you to hit. Otherwise, if you go rising stage, it will become aggravation, and the trouble of the patient will become really difficult, right? So it has then the time to effect all changes required, a requisite for restoration of the health. So what will happen after the right remedy? You have added the remedy in the decline, that is reducing phase of the paroxysm. So next paroxysm, suppose it is coming from here, it should now start from here, right? Duration will increase. Or if the paroxysm should go this high or this high, then what will happen, that after the remedy paroxysm will go only this high, only this, so remedy will break the intermittency, remedy will reduce the suffering, remedy will increase the recovery. That is the role of a bright prescription for us. 236 is all about that do's and don'ts of intermittent fever. Into that, if the remedy is given in an increasing stage, it will really aggravate, really aggravate. And here is another advice what Hahnemann is telling, that if the medicine is given immediately after termination of the paroxysm, that is to say apyrexic interval, before the next paroxysm occur, patient will be having a good opportunity to recover. If given increasing paroxysm, violent contention is the word used by Hahnemann. Violent contention means severe accident, you know, clash of the titans. It's like two big like the big fight, violent contention. The vital force will be having violent contention, and it will become absolutely dangerous situation if you do like this. And it commonly, see the word, this is commonly observed in fatal cases. Fatal cases in which a moderate dose of opium is given to reduce the stage. That's different story. It's not connected with COVID at the moment. So here, the violent contention, if you want to avoid, you should not give the medicine to the increasing stage. Otherwise, it will become really the hit. But in allopathically treated COVID cases, you are not able to see the paroxysm. So this reaction doesn't make sense because patient is already suppressed with antibiotics, paracetamols, painkillers and all. Right? This is 236, 237. Very important. There is called serious cytokine storm. If you see how, I mean, I don't know how many of you have treated patients in ICU. I don't know. But if you see patient is in ICU, have very sharp rise of temperature, they have temperature, they have given paracetamol, within half an hour, another temperature spike. They have given another paracetamol, within half an hour, another. So what Hahnemann tells that the phase of apyrexia is very short, then in the decline phase you have to give. In stage of hyperexia is very short. It happens in very bad fevers. If they are disturbed by some after paroxysm, homeopathic dose should be given in the perspiration stage. That is the decline stage. So what will happen is that phenomena of expiring paroxysm will begin to diminish. So vital force will have more time to recover before the next paroxysm comes up. I have only one experience of a patient treating in ICU, and he has improved very well homeopathically. He initially used to get fevers every 1 hour. After my medicine, every 2 hours. Repetition of the same medicine, more equal frequency, paroxysm at 6 hours. Slowly and steadily, patient came out of the ICU. Now at the moment, he is fine at his home. Otherwise, doctor himself has said that there are very less chances that he will recover. This aphorism came and helped me out. This is all organon. I would say the title of this webinar, 2 days webinar should be like COVID-19 and organ of medicine. It's so connected, right? 238, when to repeat the remedy? When to repeat? We repeat, but when to repeat? It is equally very important for us to understand. It is a suitable remedy has with a single dose destroyed several feet, but if there is relapse, you should repeat. There is, if what you call it, if you say 245 aphorism, 246 aphorism, 250 aphorism, Hahnemann says till improvement last, no repeat. Same is here, 238. Till the remedy is controlling acute, don't repeat. If there is relapse, you have to repeat. There is no other option, right? 238. Into that, what Hahnemann tells, this slide, is completely for today. It's like Hahnemann has written this for corona. What can be the reason for relapse of same fever? Why there is a relapse? Why relapse in acute? Why patient has relapse of corona? The recurrence of the same fever after an interval of health is only possible when the noxious influence that excited the first intermittent fever still continues to act upon the convalescent. That is, अपने आजू बाजू में कोई कोरोना वाला होगा, हम कहीं ना कहीं कोविड से एक्सपोज हुए हैं तभी रिलैप्स हुआ है. Otherwise, there cannot be relapse. And you also can understand there has to be exciting cause for relapse, right? Exciting cause or maintaining cause. In what you call in marshy areas, it's a different story, right? What used to tell people are go away from that area. Now, what is the scenario out of this relapse? People are getting tired because of COVID, frightened. Surat, big city is getting emptied. Bombay is getting now emptied. Getting emptied. They have not yet emptied, but they're 10% population, 20% population migrated. Ahmedabad, they have migrated. People have migrated now. Why? Because you have to get, you have to leave. You need to have your health. Nothing is more than health. So this noxious influence, if it works on your convalescent continuously, you will have relapse. The same is situation with corona. We don't know how many COVID patients are roaming around us. Maybe my wife is COVID positive. Maybe my father is COVID positive. Maybe my mother is COVID positive. Maybe my hospital family is COVID positive. I don't know. So what is needed? What is needed is ultimately you need to have good lifestyle, good diet and regimen, and good other thing. What Hahnemann tells after this aphorism. So relapse, if it is coming to you, always focus for a cause, and that cause has to be visible, has to be visible. And if you want to relapse, if you want to prevent the relapse, if you want to prevent the relapse, that should be this aphorism. As every medicine causes a peculiar action, pure action, spatial peculiar fever, even a kind of intermittent fever, which is alternating state, differing from all other fevers caused by other medicine. Homeopathic remedies may be found in extensive domain. That intermittent fever get maximum proper match, and then as a result, what you need is antisoric. What you need is antisoric. So without making a COVID treatment, if you give antisoric, considering constitutional totality is also bad. And if you take acute properly, if you manage acute properly, you are able to help the soul properly. But you miss to give them a constitutional proper chronic homeopathic cure, relapse is likely. So if you have a patient having multiple relapse, one time, two time, three time, four time, as soon as patient get better, you see the chronic state and you treat it. Otherwise, it's a big risk. It's a very big risk, right? So much of the time. Yeah. Okay. So in this way, but if this is 239 is about acute, proper acute, absolutely proper. How to treat intermittent fever? Every medicine peculiarly produces fever. आर्सेनिक का फीवर अलग है, पल्सिटिर का फीवर अलग है, एपिस का फीवर अलग है, बेलाडोना का फीवर अलग है, जेल्सिम का फीवर अलग है, सबके फीवर्स अलग अलग हैं, right? So that you have to match. That is first, and then is antisoric care. Antisoric prescription if relapse of fever. That's what Hahnemann says so clearly. But if the remedy found to be homeopathically specific for a prevalent epidemic of the fever do not effect a perfect cure in someone or other patient, if it be not be the influence of the martialistic that prevents the cure, it must always be soric miasm in the background, in which case antisoric medicine must be employed until to complete or relief is obtained. So what is needed? You ask yourself how many COVID patients you had seen, into that how many relapses you have seen, into that how much of difficulties you have relapsed. Antisoric. Antisoric is your answer. Constitutional homeopathic care is your answer. And that's what Hahnemann also advises, that even the name of the medicine which you should give to soric intermittent fever, that is 242 aphorism. I am coming on to that, right? So that will be probably the last aphorism. So 240 is antisoric is an absolute must. Absolute must. So 239 is about fever management, right? 240 is about prevent relapse with antisoric. Third is about intermittent genus epidemicus. What you call, there is always a genus epidemicus, but it is different from country to country, different from location to location, different from community to community. The genus epidemicus from US cannot be genus epidemicus to India. The genus epidemicus from India cannot be genus epidemicus to Australia. You have to see the totality symptom of those patients, maybe 15 patient, 20, 30, 50, 100, whatever, and then you try to find out a genus epidemicus. It's not advisable that you find in some country apply to globally. It's not a situation, right? So here what Hahnemann tells, कोई भी epidemic fever आप देख लो, कोई भी epidemic fever, whether you consider cholera, whether you consider measles, whether you consider smallpox, whether you consider corona, whatever you take, malaria, whatever you take, it's composed of single acute paroxysm. It has single acute. What is with COVID? Fever with respiratory issues. What is with cholera? Diarrhea with dehydration, leading to fever, right? So whatever you take, malaria, the fevers, whatever you take, smallpox, eruptions with fever, single acute paroxysm, always. Every intermittent fever you say, it is always composed of one single acute paroxysm. What is COVID? COVID, have you heard of COVID which produced, urinary tract infection? Have you heard COVID produce kind of, typical constipation? There are cases exceptional, but what is common? Sardi, throat pain, udras, that is coryza, throat pain, cough, fever. This is the acute paroxysm. That's all. In single epidemic, peculiar uniform character common to all the individual attacks. So this is common to everyone, but every common has uncommon in it. That's what we look at it. Every individual case is completely different than what it is. So what Henneman tells is there is always something uncommon in common. And that's what we are here to look at it. And that's how we can come to know that single acute paroxysm will give you a range of remedies. Right now, what remedies you want? Fever is respiratory pathology remedies. Prionia, Entimtat, Gelsemium, Ferrum phosphoricum, Belladonna, Arsenicum, Ipecac, phosphorus, etc., etc. Right? Because this is the need of the time. This is the location and this is the pathology we are hitting at it. That's all. So clear. And in this, Hahnemann doesn't end here. Every epidemic, every single acute paroxysm, but when this character is found in total symptom to all, it gives us the discovery of homeopathic specific remedy suitable for all cases. But here, all cases does not mean all the cases globally. All the cases of that particular area. And all cases means the cases which you have seen in a very specific, what you call diameter. There is nothing like global genus epidemicus, because every epidemic is completely individual by set of symptom. If you change the country, because the what you call the immunity of the community, what you call herd immunity, is completely different to US, completely different to Italy, completely different to Germany, completely different to Pakistan, completely different to India. It cannot be like one remedy to all. It's not logical, right? Which almost universally serviceable in those patients who enjoy tolerably good health before the occurrence of epidemic. You know, patient, why? One of the homeopath in my knowledge who studied in the college, we have a college in Anand where I practice. One of the homeopath who studied, he was working in COVID war. He died because of COVID. He enjoyed tolerably good health, but probably this exposure was very intense. Otherwise, he could have survived. So many COVID people are dying. Doctors are dying because of COVID, because there are many reasons behind this. And if you are able to understand the reason and if you're able to manage it, most of the time it will help you. So it's like 241, 241, right? Now here Henneman tells beautiful. Just a second. Friends, can I have your feedback? Am I fast? Am I slow? Am I okay? Can I have your quick comments, please? Hmm. Thank you very much. Thank you, everyone. Thank you very much. Okay. Now is something about what you call the secret. Henneman is giving you secret. Organon is a book of secret codes. Every word has a lecture in it. Every word has a chapter in it. Every word has an what you call typical meaning in itself. Organon is a book of secret codes. Those who are able to envision, those who are able to understand these hidden secret codes of the organon become genius. And this 242 aphorism is so very clear. Hannibal is giving you a secret how to handle acute disease epidemically, how to handle epidemic acute diseases. And that is the secret is this is the secret. Second part of 242, where we have now to do with psoriatic intermittent fever. We know that the patient has no problem, but he has relapsed. The patient has relapsed. The patient has relapsed. The patient has relapsed. generally subdued by minute and rarely repeated dose of sulfur or hypersulfur in high potency. So if you have relapse, you have one patient where you treated, relapse. Second patient treated, relapse. Third patient treated, relapse. Same repeat, treated, relapse. Then you should think of sulfur or hypersulfur. But don't give blindly. Try to find totality which is fitting to them. Either patient is hypersulfur or sulfur. That is, sulfur is a component and recurrence tendency is of SORA, and sulfur is highly soric remedy, anti-soric remedy. So that breaks the tendency. So this is the secret. And that is what Hahnemann tells here. That if, however, either the first paroxysm of the epidemic intermittent fever have been left uncured, you know, cure was not, people recover out of simple sardi and cough, uncured. Or patient have weakened because of improper allopathic treatment. What you call, one of my relative had a COVID, was hospitalized. He developed Parkinsonism after the allopathic treatment. You surprise. You surprise. But it's a fact. So his immunity is weaker after improper allopathic treatment. He has recovered from COVID, but he has now become a patient of chronic trouble. So then the inherent SORA, SORA was inherent. When the acute was there, SORA was inherent. But that comes on surface now. And then what you call hydra-headed monsters. 81st aphorism. Sabka baap, SORA. That comes on play, and what happens is relapse of the corona again, relapse of the epidemic again, because you have really poisoned vital force out of the wrong medicine. As a result, patient will suffer more than what it was suffering. What you did, you harm, then help. That's what is very common with allopathic patients. Right now, government is not allowing, otherwise there would have been a great research being made. 60 patients, 100 patients treated homeopathically, absolutely research, and 100 patients treated allopathically, research for 2 years. 100 patients of treated allopathically under observation for 2 years, 100 patients treated homeopathically under observation for 2 years, and you see the level of health. But is something which is not not the air at the moment. But I always tell to the people, I always to the world, you have to come to homeopathy one day, either by choice or by compulsion, because there is no other way. You have to come to it because there is no other option left. Sooner the better. Sooner the better, wiser you are. It's like that. So 242 aphorism is so that which would have been the medicine which would have been helpful in first paroxysm, जो acute में दवाइयां दी थी उससे कुछ फायदा नहीं होगा. Now we have to work with antisoric, and that antisoric proper is either the two will come in most of the cases, hypersulfur and hypersulfur and sulfur. Latent symptom, latent SORA, no symptom. Developed SORA, perceptible symptoms. So here, when the first phase was working here, first paroxysm epidemic fever, the SORA was latent. But in this case, SORA became active. And as a result, what you did is antisoric medicine, the acute medicine which you were doing, helping, it will not be able to help. What you need is antisoric remedy. And then the last but not the least is 244. You have taken a case well, you have prescribed, you have managed, but you have to advise also, né, that how you should maintain your good health. And 244 also tells what type of the people will affected by epidemic. What type of people? Healthy man with his youth become habituated will less be getting affected. See, a lot of youngsters because of COVID they get affected, but they don't have problems. You know, then those people who are fit by exercise, fit by diet, fit by those immunities not lowered, or they do not have pernicious passion, they become sick but they recover faster. Right? The intermittent fever will affect them, but will recover. If they don't recover, give them China. That's what Hahnemann says. Give them China. So here in epidemic of corona as well, many cases are China. Typical China, bitter taste in mouth, intermittency of the fever, typical, head hot, body cold. Many symptoms are there of China. It may required. So the first point, the point number one here is about habituated, but they have good health. Their faultless regimen and his system is not lowered by want or fatigue or punishes patient will recover faster. Second, those who have not recovered, they need China with regulated mode of life. Of course, you have to remove the maintaining cause, right? And third, in spite of giving China, they don't recover. They need constitutional proper antisoric care. They need proper constitutional antisoric care. But the person who are taking physical corporal exercise and pursuing healthy regimen of intellectual occupation cannot be cured by Marcy intermittent fever by a few doses of China. Such fever, in such cases, a proper constitutional homeopathic care is needed because they are really sick because of the Sora. And if those people, now about the people who die because of COVID, fourth point. It sometimes happens that even with this patient exchange without delay, the Marsi district for the one of that dry mountain recovery apparently achieves. Fever leaves them if they are not deeply sunk in Sora or they are not fully developed. The old aged people with fever, with COVID, they don't have that much of great symptoms acutely, but they are deeply sunk in Sora. And as a result, they end their life. In such cases, homeopathy can bring them back. So here in if the fourth category, the old aged people, the senior citizen people, the people with heart disease, the people with cancer in the past, the people have bypass surgery, the people have kidney failure, or the people have complex disease in one body, you need a proper homeopathic care only. Allopathy can be given occasionally. It's like that, right? And here, what Hahnemann tells us, summary, what Hahnemann tells here, four type of the criteria of Hahnemann is given in this aphorism. One is healthy, they recover on its own, right? Moderately healthy, lifestyle modification, advices will help. China also will help. Point number three, Sora not yet fully developed. China will be given helping. Sora not fully developed, but you give antisoric treatment, they will recover. And Sora fully developed, they are deeply sunk. Either they will die or you have to battle, you know, for 2 months, 3 months, 4 months to bring them back. This is the summary of the whole aphorisms. And what is needed in such an acute, such an epidemic is diet and regimen. What people have taken a lot of Ayurvedic ukala, people have started taking homemade haldi, what do you call then adrak, and then what not, tulsi and vitamin C and lemon and all. Why? The diet and regimen modification is needed. Good physical exercise, for lungs, even our honorable Prime Minister Narendra Modi also says, do pranayam, do om chanting, do bhastrika, do yogasana. Why is this? Absence of pernicious passion, because your immunity will be broken and removal of a maintaining cause. So in such a situation, to conclude here about epidemic disease is like, homeopathy has a great potential to treat epidemic, but but you need to know how this works. Otherwise it is just a literature, a piece of paper without useful information. And in this, to have a cherry on the top, apart from the lecture, I want to give you something for acute, how you should read, what aphorism you should read, and how you should manage. What is acute disease? Paragraph 5, 70 to 73. Acute case taking 92, 95, 99, 149, 152, 162, 262, 263. How simple? How to treat acute disease? 149. Subside insensibly. Word use subside insensibly. 152, 153, 157, 150. Diet and regimen. Acute 260, 263. Frequency of repetition 303, 246, 247, 248. Then what will happen? After you treat, similia similibus curantur. Whether you are taking a case of epidemic, whether you are taking a case of chronic, whether you are taking a case of whatever. Simulus curantia has to be there. So paragraph 27, 68, 148, 157, 282. Spot on. Will give you a guideline. How cure takes place. How cure takes place. 68, 148, 155, 186, 282. And PQRS. How to find PQRS symptom in a case. I have a separate lecture of 2 hours. How to value PQR. What is PQRS symptom? How you can come PQRS symptom is coming to you. You know, 133, 153, 153, 154, 164, 165, 178. This will help, right? So I conclude my, okay, I missed this point. Potency selection and repetition. Potency selection and repetition. Paragraph 3 is 168, 170, 246, 247, 248. Mode of application 228, 246, 288, 289, 290, 291, 292. Size of stimulum 157, 253, 254, 255. These are aphorisms number. Huh? Here you get the information. This is advanced organon. I mean, this is advanced version of reading organon. People read by index. Once you are acquainted with the subject, you jump from one place to one place. Like what I have taken about epidemic. Paragraph, 73 to straight away to 199. Sorry, 100, 101, 100, 101, 102, 103. Then jumping to 235, 236, jumping to this and that. It's like that, jumping. But you have to know, you have to understand organon properly. Otherwise, it is a piece of paper with useless information, right? So I conclude my talk here with a last quote from Dr. Samuel by Dr. John Ware, given to Samuel Hahnemann, which I really love. I love this quote because what Hahnemann tells today is even true 250 years after. This is a beautiful painting I have in my hospital, in my own chamber, which I always, look at it and in anticipation of the blessings from Hahnemann. When great people die, it is said that they leave their ideas, thoughts, desires, and even senses for the future generations to come. Organize the book, which has ideas of Hahnemann, thoughts of Hahnemann, desires of Hahnemann, even senses of Hahnemann to guide us. It is going to be more than 2.5 century year past. Dr. Samuel Hahnemann, he's still alive like a glowing husk in his word, in his work. Glowing musk in his work. He's still alive. I read Organon, I never feel that Hahnemann is no more. Hahnemann has always been not up to date, but before date. And that's still obtained. Remember, can you imagine a book? It's like Bhagavad Gita. It's like you take any book which are written ages before, coming true today. This is something which is phenomenal. I mean, allopathic science has to change every day, every week, every year, every decade. They are ever changing. Homeopathy is eternal. So I always feel very proud as a homeopath. And I always feel a proud child of Samuel Hahnemann because, if our father is, member of parliament, we do like this. If our father is chief minister, we do like this. If our father is prime minister, we do like this. Then our father is the person, second most popular system of medicine in the world. Then we should definitely have like this. That's only possible if you understand him properly, right? These are the two branches of the hospital, the academy, Samuel Hahnemann Homeopathy and Sri Homeopathic Hospital. We have a lot of courses also being run. If you are interested, visit my website for better information. So, and I thank you everyone. Yes, Dr. Ishmeet, Mrs. Ishmeet, please advise for more queries or questions what people have. I will be very happy to answer.
Sure, sir. And first of all, I should thank you because it was indeed a wonderful webinar. Great explanation. As usual, it was wonderful.
Thank you.
So, we have so many appreciation message as well.
But I don't know. I'm not able to open the chat. I think Zoom is not
I'll tell
liking
you,
me.
Dr. Setu
Just a
Madhav
second.
is saying very interesting talk. When hear you,
Okay,
you are
now,
one
yeah.
amongst us, not a lecturer, delivering the subject from the podium. Thank you so much. Wow, great. Dr. Hitarth Mehtaji, thank you for joining. And yes, it is indeed a great session by Dr. Krutik. So, in case
Now
you
I'm
have
able to
any
see. Yeah.
questions, I would
Yeah.
request you to please share it in the chat window. Dr. Krutik would be very happy to share
Yes, yes, definitely.
answer. Yeah.
Yeah, if I stop screen, then I can see the chat. Otherwise, I
Okay.
am not able to see the chat.
All right. No issues, sir.
Thank you, everyone. Thank you, everyone, for your enthusiastic remark. To be honest with you, as I said always, maybe I'm repeating again. There is no value of Dr. Krutik Shah. The value is of Hanuman. My mission is to take you to Hanuman. And if you meet Hanuman once in your life, you don't need anybody else. And
Very
that's
true.
what I can tell you. Here everybody wants to be Hanuman, but Hanuman is only one.
Mm.
And believe me, nobody can even make little of the little against what that man is all about. So my deepest wish is to all of you to go to the literature of Hanuman and start from there. Because if you want to get the best, you if you want to really get the fruits, go to the roots. Otherwise, there are many Hanumans roaming around us. But सबका बाप एक ही होता है. So I always believe you should go and meet Hanuman, right?
Right,
Otherwise,
sir.
Krutik Shah has no value. I don't think I have a value. Whatever I have said is just the words from Hanuman only.
All right, sir. So I don't think we have questions. Okay,
Yeah,
yes,
yeah.
the questions are coming in.
Organo 6, we are waiting. Yes, 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 Dr. Ma'am. I think we are planning it out, but we have little issues here because I am committed with some other urgent responsibilities. That's one of the reason it's getting delayed. Yeah.
Okay, we have a question. After COVID, though the patient is fine and has no symptoms, but his D dimer is still high, what is the approach?
Constitutional approach, proper case taking,
Okay.
proper case taking. Yeah.
Patient is having continued fever for more than a month after COVID. All investigations are coming normal. What can it be?
Either you take an acute state. See, it's like there is a possibility that you undergo all the reports of fever, but all the reports are normal, but still patient has fever. So patient is patient, and patient is always right because he's suffering. He's not a psycho. So what he's telling, you understand the symptoms, and you really make it into totality, and then you go at it. If you are getting a good acute prescription, you hit it. Otherwise, there are many ways, and you can go even constitutionally as well. It's always a highway. So, what is needed? If the patient is still having fever after recovering from COVID, you should always take a case, for the as if a fresh case, see the symptoms, and if you're able to find a clear acute remedy, you prescribe. It's like that.
Right. Okay, so I think we don't have any more questions. All right, so I would thank you for giving us your time for this webinar, for continuous 2 days webinar, which we did for the first time, and we got great response. Thanks to you and thanks to the all participants who have joined in spite of festive time and in spite of festivities, if doctors have joined. So thank you so much for joining, and we wish you happy Diwali, happy Dhanteras, enjoy the festival, and we will see you soon with the next webinar. Very soon we will inform you in the WhatsApp group of iSampark. Also, the digital